Some patients only have pain in the center of the back, and it's only when they're standing. They don't have any pain in the buttock or in their legs or any numbness. And as soon as they sit down, they're perfectly fine. There's only one thing that causes that, and we don't even need to get any tests. As people mature, the intervertebral disc between the vertebra can become degenerated. So it's degenerative disc disease, and without this spacer, it's very mechanical. People develop arthritis in these joints. So when the joints are the source of the pain, there isn't any pain when they're sitting, so they're fine. As soon as they stand up or try to walk or have a problem, these patients have problems standing long enough in the kitchen to make a meal or going to the mailbox. They often lean on a cart when they're going shopping, but as soon as they sit down, they're fine. So when this is the source of the pain, there's two things that contribute. Some of it's the underlying structural degeneration, which happens over years and decades. And then at the time the pain started, they did something different, often physical or strenuous, that develops an episode of inflammation. And then the narrowing and degeneration that's always been there and the inflammation, which is new, then together causes the symptoms. So the first thing we do is do treatments that is known to be needed to resolve the inflammation, and that's injections under X-ray guidance where we put steroids into these joints. These are so effective that people get complete relief that can be very long-lasting. If that doesn't help patients or it doesn't last, for 6 months or more, there are other treatments for this. It's basically arthritis of these facet joints. The medical condition is called spondylosis. And since it is arthritis, there's over-the-counter and prescription medicines for that. Prescription medicines can be taken by most people, but not if you're on blood thinners or have kidney disease. But the other procedure that we could do is called radiofrequency ablation, where some people call it burning the nerves. There's these tiny sensory fibers that go to the joints, and under X-ray guidance, we can put probes there and apply heat to try to disrupt the integrity of the nerves, which will take about a year for them to grow back. It's not a permanent procedure, but that ablation is what we do if the injection of the steroids don't provide benefit. So once people are healed, then they would never have pain again unless they get a new episode of inflammation, and that's preventable.